integrated practice has completely changed the way we are doing mental health care delivery. Before it came in, it was very haphazard. Sometimes we would make a phone call to an organization that was available to us. Sometimes we would give a number to a psychiatrist or psychologist. Sometimes we would say, we're going to try medicine, come back in a couple weeks. And often we would just give information to the patients or the families, let them take the primary responsibility for what role they needed to do, and then we'd follow up as we could. But now with primary care integration, with the integrated model, it's completely changed that we have resources available to us now that's in the office and can do much more significant follow-up and have more opportunities available in the office immediately.
There are so many ways integrated care has been important and successful to both patients and to the clinics. What we want to do is, when we create integrated primary care, is providing that patient-centered medical home for the patients in the clinic. We really want to address the stigma that's associated with mental behavioral health services, and it's having that team-based care approach. Is if the doctor, the provider is noticing that something is coming up during their visit, that they have that ability then to pass that on, to have that warm handoff to this professional, to this behavioral health consultant that can help out that patient in need of those services. And it's brief services, it's those targeted interventions, it's preventions, and really what we want to try to do is, the earlier we could get in, the earlier we could provide these preventative services, we could change the trajectory of a lot of these young patients' lives.
I had a patient who happened to be a Colorado Access member who I had been seeing for a while, evaluating for depression and treating for depression, who came in and wasn't doing as well as she had been before. I was able to involve our behavioral health consultant, Bridget, in the case. Bridget and I recognized that this patient really was in kind of a crisis type situation. She had not been going to school and was at risk of not graduating from high school that year. She had planned to go to college, but because of her mental health issues had not been able to attend school. That patient did very well and did graduate from high school on time last year. So I think, had Bridget not been involved, I don't know that I would have had the resources or the knowledge that Bridget had that helped that patient get the resources that she needed in order to be successful and go on to college this year.
The relationship we've had here at the Mental Health Center of Denver with Colorado Access for integrated care efforts have been huge. What I've seen from when I first started to where we're at now has been a tremendous growth. Mental Health Center of Denver and Colorado Access has always had that relationship together, but really putting forth something where we can have the closer collaboration of going out and talking to clinics for the both of us made a huge difference. And I think that's what we've seen in the past 2 years was the Mental Health Center of Denver, Colorado Access were able then to start having discussions, having meetings, and going out to area clinics together, and then talking about the integrated care services, what our program was able to offer to their clinic, and then what would be the relationship that we would have here at the Mental Health Center of Denver and Colorado Access, and how those services would look then in the clinic. And it's just been amazing because the clinics at that point were just hooked, and they just really loved what they heard, and they couldn't wait.
We weren't really familiar with what the integrated care model was, but Children's Hospital gave us some general ideas. We brought Bridget in as a fellow and then started understanding that this actually will change exactly what we want to do with medical health and mental health. That the idea of a medical home really would come to fruition. That without Bridget, we really didn't have a medical home. We would have some parts of it, but couldn't complete it without having this care. Then the Mental Health Center of Denver has also stepped in to say, well, we're going to support the program. They've continued the support that we've had so we can able to have Bridget in the program. And then the next step now is that Colorado Access is providing an enhanced payment model where we can take it hopefully even further, where we can have more available services from Bridget.
I have found that being an integrated clinician within a pediatric practice helps to break down barriers and walls to care. Oftentimes, families that have limited resources and limited supports, they may only be able to make it to one medical visit, potentially per week and or per month. And if they have to choose one, more often than not, they're going to choose their medical provider and their medical home. By being in a medical office, I'm able to help coordinate services and increase access to care. And by doing so, there's also another element of breaking down those barriers to care. Furthermore, we are all well aware of stigmas that come with seeking out mental health services. And by being in the office here, that helps to reduce the stigma. It also gives us the opportunity to have buy-in when we work as a team with our medical providers who invite us in to spend time with the families that they're seeing for their medical care. It gives that trust for me to be able to refer our families to other resources when they're needed. So if I identify a need, that I might be able to say, I can actually refer you to my employer, who's Mental Health Center of Denver, and get them the access that they need for those services, as well as working with the care coordinator here at Lowry Pediatrics, which may provide some assistance around making sure they're able to get to their appointments through transportation support and things of that nature.
At the very beginning, we started without knowing what it was and came to realize that now we have somebody in the office that can help us directly with all those issues I mentioned before, and from anything at the beginning when a baby's born up until those teenage years. So now we can call Bridget and say, hey, this family just has some questions about sleep issues, or this kid is thinking about suicide. We really need some support. So not only does she help us in the room, but she also helps the families that they have a direct contact in the practice.
There's one family that comes to mind almost immediately, and they were struggling to get connected with services. They had somewhat been routed around to a number of different services through different agencies and just had struggled to gain continuity of care. And their only home base was here at Lowry Pediatrics. What I was able to do was meet with the family, spend some time finding out what their behavioral health and mental health needs were, as well as other support needs that happened to come up as we talked more and more about what was going on. I was able to work with their medical provider, who at that time was doing some work around maintaining their medications, and then get them connected with outpatient services through Mental Health Center of Denver. They eventually were able to step their care up to home-based services, and additional questions did come up regarding their further needs and care, and I was actually able to work with them and the Mental Health Center of Denver team to also get them set up for formalized assessment. And currently, from what I understand, the family is doing well, and they're primarily managed for their mental health services at Mental Health Center of Denver, and they continue to have their medical care managed here at Lowry Pediatrics.
I think that's what integrated care really does. It's providing the right service at the right time for that person in need of those services.
It's been nice that the patient can do it all in just one location here, in a location that they've been to for years and trust. So it's been very good for the patients and really nice for us as well.
The medical home was sort of an idea, a vision, but then seeing it in practice really has enlightened me, and I think the rest of our practices, to really what we can do as a medical home. And it's remarkable because patients now know that they can come here, and not just for their medical needs, but their mental health needs, and they know what's available, that if we have additional needs, if we have requests, if we have families that are just having a lot of stress, that we have that support with them available. So it's completely changed the way we've approached mental health in our practice.